we're already sort of there, that the burden of heart disease, the burden of chronic disease is just too much for society to bear. Um,
Yeah, thank you for taking this time, by the way. I'd like to
yeah,
say before we start.
no, definitely.
Okay, so yeah, let's get into the questions. So, I mean, would you like telling us about, your profession, what you do, and just in general, so overview of everything?
Sure thing. So, my name is Philip Ovadia, and I am a cardiac surgeon in the United States. So, I have been a heart surgeon now for 20 years or so, and done over 3,000 heart surgeries and taken care of lots of sick hearts. And during much of that time, I was very unhealthy myself. I had reached a point about 8 years ago where I was morbidly obese. I was pre diabetic, and I realized that I was going to end up on my own operating table, so to speak. I was going down the same pathway that a lot of my patients had gone down. And I didn't really know what to do because I was following the advice that I had been educated to give my patients, and it's all the advice that we've heard: eat less, move more, eat a low fat diet. The food guidelines, especially here in the U.S. We have the food pyramid. I know you guys are probably familiar with it up there as well. And I, was at a loss because that's what I was doing, and it wasn't working for me, and it wasn't working for my patients. They were all still ending up on my operating table. And, I started to ask some different questions. I came across some different information. And ultimately, I was able to first improve my own health. I lost 100 pounds. I reversed my prediabetes. And along the way, discovered, what my patients should be doing to avoid the need for heart surgery. Because no matter how good a heart surgeon I might be, no matter how good all the heart surgeons out there are, you're never as good after you have heart surgery as you would have been if you didn't need heart surgery in the first place. So I now focus on helping people not to need heart surgery. I wrote a book, came out last year or a year and a half ago now, called Stay Off My Operating Table. And I now work with patients to help them avoid the need for heart surgery.
Well, thanks so much for telling us about how you have been helping so many lives throughout the many years that you've been in this profession. And we thank you for everything that you've done, even though we haven't seen it, but we thank you for everything. So, our second question is, why would you say the heart and cardiac field needs to be highlighted within the mainstream media?
Yeah, so heart disease is the number one killer in the US, worldwide, in Canada. It is the number one killer by far. The number two killer, cancer, is, there's a big gap between heart disease and cancer in terms of the number of people who die every year from that. Heart disease is the most, prevalent chronic disease we have in our society. The and so that's why we need to emphasize it. But what's really powerful, and what I think can be very impactful, is when we're addressing, the root cause of heart disease, the true causes of heart disease, and we'll get into that as we go through this discussion. But addressing the root cause of heart disease addresses the same root cause of so many of the chronic diseases that we face. So when we look at things like diabetes, Alzheimer's disease, many forms of cancer, and heart disease, they all share a common root cause. And if we start addressing that root cause, we can really impact all of those things.
So just, moving general in the direction of cardiology and whatnot, for a student or an intern, what are like three pieces of advice you would give maybe entering the medical field who might be wanting to go into cardiology?
Yeah. So my first, piece of advice is to remain curious. as you're going through your education, you really need to remain curious. You need to ask questions. You want to be thinking about, what is the root cause? What causes the diseases that we are facing? All too often in medicine these days, we focus on treating the disease, treating the symptoms, dealing with the outcomes of the disease. And we forget to ask about what caused that disease in the first place. Um, the other piece of advice I would give anyone who's thinking about going into the medical field is, making sure that it is your passion. It takes a lot of hard work. The educational process is long, but it is a very rewarding, profession, and you do get to help people. But you want to make sure that you are truly passionate about it. And that, I think, would be the best advice that I could give to a student who's thinking about going into the medical field and going into heart health in general.
Well, working as a cardiologist for this many years, would you mind giving us some of the insights on surgeries you have done?
Yeah, so as a heart surgeon, the most common surgery that I do is what's called a coronary artery bypass, oftentimes abbreviated CABG, CABG. And what that operation does is it deals with the most common form of heart disease, which is what we call atherosclerosis, buildup of plaque within the arteries of the heart that ultimately lead to uh, reduced blood flow through the arteries of the heart. And so, as a surgeon, I deal with that with what's called a bypass operation, where we're actually rerouting the blood around the blockages, essentially. And that's the most common heart surgery that I do. Second most common is going to be operations that deal with the heart valves. So in our heart, we have four valves, and they can develop various problems. They can become leaky, or they can become tightened, what we call stenosis. And we oftentimes have to do operations to deal with those. And so those, that probably amounts to about 90% of the work that I do. There are various other issues that can come up with the heart that we sometimes have to deal with surgery, but those are the two most common things.
So, going on from the points you said before, what are some concerns you have with like cardiovascular disease in general? I know you were talking about root causes and how they're similar to other diseases. So, if you want to expand on that, maybe.
Yeah, so exactly. So, one of the things we need to talk more about that really doesn't get discussed enough is the true root cause of heart disease. Um, and it is, what I call and what many others call metabolic health. So, to unpack that a little bit to explain it, metabolic health basically refers to your body's ability to properly use the inputs that you are giving your body. And the primary input that we give our body is the food that we eat. So ultimately, what we need to recognize is that the food that we eat is the primary determinant of our health. And we really don't do a good job at getting that message across. We all too often in the medical field focus on the medications, the surgeries, the treatments that we can offer. And like I said, I think it's real important that we take a step back and start asking why we get these diseases in the first place. And the most common answer to that is it's because of the food that we are eating.
Now, could you expand on some of the different types of cardiovascular diseases and the effects that they have?
Sure thing. So, as I said earlier, the most common type of cardiovascular disease is what we call atherosclerosis. And that refers to the buildup of plaque within the arteries of the heart. And this really starts with damage to the blood vessels of the heart. And that can come from a number of different sources. The food that we eat, for instance, like I mentioned, smoking is a common thing that can damage our blood vessels. having a high level of sugar in your bloodstream, diabetes, can damage the blood vessels of the heart. And so that over time will cause plaque to form in our arteries, and then it leads to blockages in the arteries. These blockages can then lead to a heart attack, or they can just reduce blood flow to the heart enough to be causing symptoms and problems. We then have what's called valvular heart disease, as I referred to earlier. Again, this is when a problem develops with the valves in the heart. And the two most common things that can occur are either the valves start leaking or the valves become stiff and tightened. We then have what we call heart failure. And heart failure is a general term that means that the heart is not pumping as effectively as it should. That's another common form of heart disease. Some other, maybe less common forms of heart disease, we have what's called congenital heart disease. So these are defects in the structure of the heart that people are born with. Basically that things aren't in the right place or in the right orientation. The separation between the chambers of the heart may not be complete. You have holes in the heart is the common term for it. So congenital heart disease are problems that people are born with. And then you can get tumors that affect the heart, both benign, non-cancerous, and cancerous tumors that affect the heart. And then finally, you can get infections that affect the heart, what we call endocarditis, which is an infection that has settled in the heart. And I think that's pretty much covers the gamut of heart disease. But most commonly, when people are talking about heart disease, the majority of that, the most common thing they're talking about is atherosclerosis, plaque buildup in the arteries of the heart.
So just before we move on to some questions about prevention and whatnot, I just want to ask a follow-up maybe regarding stroke and how stroke has to work with the heart and whatnot and the effects of it.
Yeah, so stroke is another form of, is oftentimes combined with cardiovascular disease. And what a stroke is basically when you get a blockage in the blood vessels in your brain, as opposed to a blockage in the blood vessels of your heart. Can be related. So again, you can get that same type of plaque buildup over time in the arteries going up to the brain and in the brain itself that can end up leading to diminished blood flow. You can get a blood clot that forms sometimes in the heart, sometimes elsewhere, but that can get pushed up to the brain, oftentimes starting from the heart. And so there is a relationship there. They're not quite the same thing, but oftentimes they get lumped together because it's the same sort of processes. It's something that's leading to a blockage in the blood vessel in the brain as opposed to a blockage in the blood vessel in the heart.
So I know you've mentioned a lot about prevention methods too, like the food we eat, smoking and whatnot. But just maybe in a general comprise this. What are some prevention methods that we can do for cardiovascular diseases? And also some maybe general tips and awareness points that people should know about, just to maybe keep a healthier life in general.
Yeah, exactly. So great topic to talk about. Not smoking is one of the biggest things that we can do to lower our risk of developing heart disease. So not smoking at all, or if you're already smoking, quit smoking. That's one of the best things you can do to lower your risk of heart disease. Eating healthy foods is next on the list. And for me, this again, what we've been told is healthy food for our heart, and what is actually healthy food for our heart may not be the same. And this is a big problem that I talk about and I deal with all the time. My big rule in terms of healthy foods to eat for your heart and for your body in general is that we should be eating real food, whole real food. So these are the things that grow in the ground, and then the things that eat the things that grow in the ground, animal products and plant products. and as close to their natural form as you can eat them. So if it comes in a package, if it has a long ingredient list, you shouldn't be eating it. You should be able to look at the food that is on your plate and know exactly what it is and what's in it. And that's kind of a general rule. Other, other areas of your lifestyle that I think are important when you're thinking about overall health and heart disease prevention are getting enough activity in your day, being active, and this can mean exercise, in the sense of going to the gym, but really, more importantly, is probably just moving more throughout your day. Simple things like taking short walks every hour. Parking further away from the buildings and doing that little bit of extra walking. Things like that can be very powerful for heart disease prevention. You want to make sure that you're getting a good amount of sleep. Also, very important for your overall health and your heart health. And then the other component that I often talk about is stress. Stress does have a significant impact on our heart, and how we deal with the stress in our life can be an important part of maintaining, health and maintaining your heart health.
So, how can we at Save the Heart use our platform and make a real change within our society?
Yeah, so I think, again, the most powerful thing we can do is to get people to really pay attention to their health. Too often, we ignore our health until it becomes a problem. And when you look at something like heart disease, we can and should be doing things to prevent heart disease from happening, all the things that we just talked about, rather than waiting for it to happen and then trying to treat the heart disease, which is never going to be as good as preventing it in the first place. So I think you guys are doing a great job, getting to younger people and getting them thinking about what they're eating and are they getting enough activity throughout their day. Can be a great way to start to make sure that you remain healthy and you don't have to deal with the problems of heart disease later in your life.
So in general, I want to maybe move on to some more thoughtful stuff and give you a background of what we're going on. So this group that we've been together with, we've previously been working a lot with when it comes to cardiovascular disease and whatnot. And what we did a few years back is that when we competed in HOSA, which we are competing in now in the awareness event, we competed in an innovation event, and in which what we were targeting to do was trying to eliminate the invasive surgery of pacemaker battery replacements. And what we did is we thought of using piezoelectricity, which pretty much takes the vibrations of the heartbeats and turns that into electricity so the pacemaker can run. So just, maybe a thought on how that would work. Maybe is it viable in the future, and like what maybe the future of technology looks when it comes to cardiovascular diseases.
Yeah, so that's a great thought that you came up with, and I can tell you that the companies that make pacemakers are working actively on those types of things. Because for someone who has a pacemaker, one of the biggest issues becomes, the batteries, the limited battery life, and then the surgery. It takes an invasive surgery to replace the battery. You're exposing someone to infection each time you do that, and it can be a problem. Um, a lot of the innovations around heart disease today are really less invasive treatment. So when you look at heart surgery, figuring out how to do that less invasively has been a major focus over the past 15 to 20 years. And we do have ways of doing that in many situations. The traditional approach to heart surgery is to open up the breastbone, and many times today, we can do surgeries working through the side between the ribs, only opening part of the breastbone. They're trying to make that less invasive. Maybe a bigger area of innovation that is a focus today is dealing with the damage that occurs from heart attacks. So, if someone has a heart attack and that part of the heart is damaged, the muscle of the heart is damaged. There's not a whole lot that we can do about that today to try and regenerate that area. And that's an active area of research. Looking at things like stem cells and can they be useful? Can you get new blood vessels to grow into that area to help that area grow again? These are some of the areas, where we're seeing innovation around heart health. There's lots of opportunity. As I said, heart disease is and probably will remain for quite a long time the number one disease that we deal with. There's lots of opportunity for improvement. Ultimately, like I said, I would like to get to a place where we're not dealing with as much heart disease and people are getting the messaging around prevention, and our food environment is changing to better support overall health. I would like to see, processed foods, processed carbohydrates, things like sugar, things like vegetable and seed oils, really minimized or even ideally eliminated from our diets. And that will have the most powerful impact on preventing heart disease and making it, not a major problem in our society anymore.
Well, we thank you for that. We also have another question shifting our gears back to the career paths. I want to ask,
Sure.
what was your motivation into becoming a cardiologist?
Yeah, so I always knew. I kind of just knew intuitively from when I was very young that I wanted to be a surgeon specifically. A doctor, but really a surgeon. And as I went through the pathway to that, so I went through medical school. Um, I enjoyed surgery. I enjoy the hands-on nature of it, the sort of immediate results that you get from it. You typically know pretty quickly whether your operation was a success or not. The reason that I chose heart surgery in particular was the heart was just the most fascinating kind of organ to me. The physiology, the way the heart works, and the way the things that we do to deal with the problems around heart disease, the operations on the heart just were the most interesting to me. And they have a lot of impact on people's lives. People dealing with heart disease are oftentimes in life-threatening situations, or they have a very reduced quality of life. And when you're able to do a successful operation, you really have a meaningful impact on that person's life, and that's what attracted me to heart surgery in particular.
So more on like your opinions on what's happening with heart. I just want to ask, with all the prevention methods and with, how people are connecting and getting to know about cardiovascular diseases at a young age, you think in the future that we can see reduction or like not it being the number one killer?
Yeah, I really hope so. It's going to take a lot of work. Like I said, our food environment really needs to change if we're going to make that come true. But I am optimistic. I see more and more people, getting the messages about how to be healthy, how to prevent heart disease. The communities I interact with, the people I talk to, the people I work with directly, that is certainly growing. People are recognizing that our society has too much illness in general, too much chronic disease. And we need to start addressing that. And I think they're waking up to the fact that the food that we eat is one of the primary drivers of that. And so I am optimistic that that message will continue to grow, continue to spread. I think, the internet is an amazing tool. The fact that, high school students from Canada can be talking to a heart surgeon, here in the United States about this, and that we found each other and connected. Those types of connections are ultimately what are going to continue to grow this movement. So I am optimistic about the future.
Well, we really want to thank you for your time today, and just to, if we want to like have a small discussion, no questions. So, we just want to ask, what are your thoughts overall? Where do you see us in 10 years, 20 years from now? How do you see our future?
Yeah, so I think we are going to get to a point where you know we're already sort of there, that the burden of heart disease, the burden of chronic disease is just too much for society to bear. There's the financial cost, there's the other costs, the lost years of life, the lost quality of life. And so, as I said, I think people are really waking up to this. And I think, in 10 years, in 10 to 20 years, I hope we are looking back at the food that we are eating today, the same way that we look at smoking. So again, you don't have to go back very far. That smoking was just very common, and no one really even questioned it. And then we started to see the dangers of it, and ultimately, we've greatly reduced the amount of smoking in our society. And I think we're headed down that same pathway with the food that we eat. We're starting to wake up to the fact that the food that we eat is harmful to our health, the processed food. And I hope, 20 years down the line, we're going to look back like we do, at smoking today and say, I can't believe everyone was eating that food. Why did we think that that was good for us?
Yeah, so I don't think we have any more questions. I'd like to thank you for your time once again. This was a great interview. We like definitely learned a lot about it and prevention methods and just cardiovascular disease in general.
Great.